So for the next bone issue which we'll be talking about is what is known as, usually abbreviated as what, MED. That's a multiple epiphyseal dysplasia. Multiple epiphyseal dysplasia. Okay, so you can see this one. Alright, you will see it. So the multiple epiphyseal dysplasia, just so you know, is a rare skeletal disorder. It affects the growing end of long bones. So if it is these long bones, it will affect, the growing end. So the growing end are what we call the epiphyses. So the epiphyseal dysplasia, do you understand? So this will lead to joint pain. It will lead to mobility issues. Sometimes it will make the person very short, than the age of the person. You understand? So causes is inheritance can be autosomal dominant or autosomal recessive, right? Genes that are mutated are all these genes lined up right here. Okay, that's for dominant inheritance. Dominant inheritance, once you just have one copy, you have the disease. For recessive one, if you have one copy, you are just a carrier. You understand? For you to have the disease, you have to have two copies. So mutation effect is, it actually disrupts cartilage development and ossification. This will lead to some abnormal bone growth. So symptoms and presentation usually appears between 2 to 5 years. Alright, common signs is what? Joint pain, there's waddling gait, alright, there's short stature or disproportionate leg. You can see that this leg is not really proportionate with the body of the girl. There's early onset arthritis. There's double layered patella. Club foot or cleft palate in some recessive cases. Alright, so diagnosis is what, radiographic findings. You get to see that there's delayed or irregular ossification of multiple epiphyses. There's flattened femoral condyles. Alright, there's short or stubby fingers or toes. Right, so genetic testing, you basically test for all these genes to see if there's any one of them that is mutated. Then differential diagnosis, alright, could be, you have to differentiate it from what, a condition known as what, the Leclerc-Petit's disease. So treatment and management is, you have the non-surgical approach, so things like physical therapy, non-steroidal anti-inflammatory drugs for pain, weight control, low impact exercise. Then surgical options like osteotomies, where they try to realign the bones and all. Joint replacement surgeries. Then epiphyseal Dysplasia, alright, for guided growth in children. So that's just what the multiple epiphyseal dysplasia simply entails.